This is the Twist Threads 29 gauge twist. And again, this all comes in a kit. So it really, see how quickly and easy we're able to move. And this was something, quite honestly, why I moved away from threads, because I thought it was just taking too much time. It's fussy, and we can just cruise with it. So whether you're a sole provider or you have amazing support like I do, it's easy enough to follow. So notice in the nasolabial folds, I'm going above it and below it, not to add more volume to it, but it's basically making sure you coat that whole area in order to give it that nice softening. So the face should have, chin.
Yeah,
Perfect. The chin, the face, we're supposed to have convexity to it. We should have light reflection. We should have balance and contour. So a lot of times patients come in and they want their nasolabial folds gone or their tear troughs. Well, if you look at a baby, they have all the above. So it's more or less softening the aging process, but not taking it away, because if you do that, then you start to look flat and you don't look normal. So moving away from that overdone, overdeveloped, trend that was for a while. I think sometimes you don't even know you're in it. I know I went through lip dysmorphia. I think most of us have. Just kind of re-identifying that and having that confidence also empower the patients to give back that youthful, that beautiful look in their skin. And really it's about the skin finish and the supportive look. So it gives you that nice, soft baby face back without just, making them not look normal again too, and identifying that. So as providers, I think that's really important to explain that during the consultation so that they have realistic results. And also that's what patients are seeking out now. I mean, the trend has definitely changed from one to the next, and they want to look like themselves, just like a baby again. So now I'm down here. Now this is something to be mindful of when somebody has clenching tendencies. It can be really tight. You're above the mentalis. Again, you're superficial, sub-Q. But if they're really tight in this area, just be mindful of the placement so you don't get into the mentalis or the DAO muscles. Doing okay, Dawn?
Yeah.
You're the best. So I'm cross-hatching it now, and I'm just following. When I'm injecting, we already did a pretty comprehensive assessment prior to. I'm looking at the patient all different angles and deciding exactly what angle I want to go on to give the best results. Because if visually you can think about how these threads are being reabsorbed, that's exactly what you want it to form in order to cause that elevated support ongoing. So I'm just following her natural facial mapping. I'm not hitting her lip whatsoever. We don't want to do that. If she did need some sort of lip support to elevate it, it's a beautiful look. The same goes with her tear trough area. But in this case, it's not really necessary. I think her width is perfect.
I have 1 inch here.
Great.
Amy, question about numbing for the patient prior to the treatment.
Yeah. So we did a topical. Now I'm just doing a little bit added support to go into the chin shadow a little bit more. Comfort level. How you doing, Dawn?
Great.
A little different than last time. Comfort measures, we do numbing. So how we flow with this using the Easy Gel, because there is that preparation time, I like to have them have a topical numbing on them, and then I do use a little bit of Lido with Epi into the areas that I inject Easy Gel PRF, and also just for extra added comfort into the areas that I'm injecting. So if you're using a blunt kit of BabyGLO, you would just go right into the insertion site just like you would use a cannula. For the sharps, I like to do exactly the same thing too, because more or less I'm going into the same injection site, just using the sharp element. How are we doing? So these are the shorter 29 gauge smooth threads. Again, smooth, we want that matrix, we want that collagenesis. So I did a combination of longer ones to hit her mental crease here, just to soften it. And I always say, ask your patient, do they like the crease or do they not? Because a lot of times patients are happy with it. We don't want to take it away completely. And the nice thing is that we are somewhat in control with the BabyGLO, because we're not going and chasing these lines. We're just recreating and regenerating what has been lost. So the idea here is to keep her already beautiful, youthful skin and also her framework back intact and that added tissue support. So I'm gonna go right up here,
And that's your last.
and that's it. And now we're gonna move to the temple. So the temple,
Question two, Amy, can these be placed under the eye?
yes, absolutely. It all depends on the patient and what they need. So many times, as Haley knows, I'm in layer 2 right now for the temporal lift. You're avoiding the superficial temporal arteries, so you are above that. And the idea is always use your non-inject, like what landmark are you trying to aim for? That's gonna give you the best results. So these are 29 gauge twist threads, 1.5 inch. And I already identified where her superficial temporal artery is. You wanna be a little deeper with these to give it that boost. Dawn, you still doing okay?
Yeah,
Are you okay if I ask you how old you are?
I am 56.
So I'm feeling her temporal crease. This is the highest area that people usually have slight bruising just because of the vascularity of it being that's a little bit more superficial. So that's why I like to use my non-injecting hand just to support the skin and do some support.
That's your 4th one. Almost done.
So we're gonna go 4 up here, counter traction placement.
And then that's your 5th.
And you can see her tissues already starting to elevate. Now I'm right above the zygomatic arch, so I'm gonna palpate there. And the idea is to get it back to the hairline as such. And you know what? The worst case scenario, if you get too much restriction or have a backflow, you just take it out. Or if you see the thread, there's really no problem with that whatsoever. So the learning curve on this is just identifying the anterior temporalis is tight. So I'm not gonna completely.
One more after that, but let me know if you want.
Perfect. I think we will be fine.
Okay.
As long as Dawn's fine.
You doing okay, Mom?
Again, we're here, pulling back, and see how I'm going back into the hairline. And I think we're actually good with that. I can feel, especially post Easy Gel, she's getting tight in there. There's no need to force it. So this is basically the landmarks. You turn to your side. Actually, we're gonna go this way. And I kept this in, so all of them are superficial. The temple's slightly deeper. Also in the mid-cheek junction, I'm slightly deeper to kind of help support that fat layer. And that's about it. I mean, you can tell we're ready to roll. I find that when you take them out instantly, it's a little bit less chance of bruising. But again, for tonight, I wanted to make sure that everyone saw the landmarks and the reason why I was injecting. So we're gonna go ahead, turn it back to Cheryl for our Q&A. We're gonna take out the threads now very easily, and we'll show you our BNAs very shortly. So ask away, please.
What are the key post-care instructions you always emphasize to patients right after BabyGLO?
Some of the post-care is basically following your regular injection protocol. You don't want to do any sort of crazy exercising right away because you want your face to rest. I always tell patients, listen to your face. So if it's telling you to rest, it's time to rest. The other thing I like to say is finish it, which we will tonight, with a Beyonce mask, which is great for post-procedure. And we will put that on. Patients also love that because they're already here for, a little bit of while. You can see how quickly we move through, but we usually do this procedure in about 45 minutes or less. And it's great. So post-procedure, you just want to follow your normal injection protocol. And you want to make sure that you stay hydrated, that you're taking arnica, you're avoiding any sort of NSAIDs such as Motrin or Advil or anything that can cause any sort of additional swelling, alcohol, of course, and for bleeding and also bruising. So it's pretty much standard. I love ending with a nice relaxing mask because we treat our patients with the utmost care, and I find that the recovery is so much better in using a mask like Beyonce, which is now new to market. And it's really great because of the healing components in arnica. So it's pretty much the same.
And did we mix the Lido with Easy Gel prior to injection?
Nope, not at all.
Okay. Does Lido degrade the Easy Gel?
So there's a whole debate about this. I don't believe the latest updates does say that, but I know when we used to use PRP, platelet-rich plasma, there was a whole controversy saying that if you do add lidocaine to it, it does degrade it. And because of the sting factor, that's why I used to add a little bit of lidocaine and do a little bit more of a comprehensive and in-depth block on it. But with PRF, there isn't any sort of additive, so I find that the sting factor and comfort level doesn't require any sort of lidocaine added to it. So I think skin prep is great with that. And yeah, it did great. Any sort of blanching you see is just simply from the lidocaine with epi that I prepped the patient with. And we're gonna go ahead and put a nice recovery mask on her. Dawn, how do you feel though?
Feel great.
Yeah?
Yeah.
Feel nice and plump
Yes.
and good. All right, awesome. And really minimal, even like episodes of blood. Usually in the temple, like I said, there might be a little bit of that initial bleeding. But after that, when we apply the treatment mask post, it's more or less gone. So patients seem to say that maybe after, if you're doing, let's say, Sculptra, Easy Gel, and the 64 threads, so the total kit is 64 threads standard, but then you can customize it as well, either add or also add to different areas if one doesn't need as much in one specific area. If we're talking in the regions, temple, mid-face, preauricular, nasolabial fold, and also the chin shadow pre-gel, you can also customize it to the patient. And as you go along, it tends to be pretty easy to say because I always say the face doesn't lie. So look at the patient, do a proper evaluation, and then you're able to identify where they might need that extra support.
Beautiful.
And when do you usually like to see your patients for follow-up after a BabyGLO treatment?
6 to 8 weeks, I find, are the best. So 6 to 8 weeks really gives you the idea because at that point, the threads have been reabsorbed into their system. We do use the Aftercare 3D imaging, so we can actually show patients visually what's going on underneath their skin, which I think is key. It's been such a great add-on to our practice here as far as regenerative modalities, and we can actually show them. But honestly, like it's great for us as clinicians, but patients already see that and they love it. So they're really excited for their second. Now, if we're talking about somebody in their 20s that are doing more of that collagen banking and prejuvenation, they might require one. So it's about getting ahead of the game and just restoring and also banking, like collagen banking, they're already collagen and elastin. So BabyGLO is pretty much good for all ages, which is fun. And so it really depends. It's patient dependent. It's about their lifestyle, about any sort of other treatments that they've had and how their overall health and wellness is.
Amy, would you say threads could be palpated through the skin after they're inserted?
Not in this case, because we are in the superficial layer. The worst case scenario is that you see a little bit of a hue of the threads if it's too superficial. So that's why when you're injecting, make sure that you are in that buttery spot, that sub-Q plane, in order to not see that. And unlike some other threads in the past, when you're buckling or anything like that, you don't really see that in a patient like that. So if you do go in superficially, and it happens to everybody, it's easy enough to just take it out and not need to leave it there or wait for any sort of complications afterwards.
Would you recommend on the same visit threads and Easy Gel?
Absolutely. I love it because the Easy Gel is going to add, it opens up that plane and it hydrates and you're already getting that regenerative aspect. So I feel like it's like that extra boost when you're doing the baby collagen threads because you're hydrating the skin, you're already using your body's own element, it's completely autologous, and then putting the threads after. So I always go deep to superficial. So if I am using a product like Sculptra, I'll go deep to bone using that. And then I'll go subdermal using unless it's in the under eye area where I go much deeper for that. And I'll use that with Easy Gel, and then after that, I'll place the threads, and I find that it's seamless doing it that way. So always think deep to superficial.
Amy, talk to me about placing these in the neck.
Yes.
Yeah.
What was the
Just like, would that yield a good result?
Absolutely. So the threads are amazing for the neck. Dawn does not have any sort of, fullness underneath her chin. So there's many times that I will place them underneath the neck and also like actually in the neck bands. But I really, really do love when you use Easy Gel PRF in the neck, in the hands and everything. So with the BabyGLO, you can absolutely hydrate the neck bands, go ahead and superficially, and then add some smooth threads or even twist back towards the ramus, the angle of the jaw, in order to give that anchoring approach.